My topic is transcatheter aortic valve replacement with a balloon-expandable valve in low-risk patients. Definition: percutaneous aortic valve replacement is a well-established treatment for patients with severe asymptomatic aortic stenosis who have contraindications for surgical treatment or high surgical risk. Advances made in the design of prosthesis and device and continuous advance in the multimodal imaging techniques, especially those of the three-dimensional type, have improved clinical results with a significant reduction in the incidence of frequent complications such as paravalvular aortic regurgitation.
Valve disease is a common form of heart disease. If you or someone you know has heart valve disease, it's important to know what it is and how it occurs. Your heart has 4 valves that keep blood flowing in the right direction: tricuspid, mitral, pulmonary, and aortic. Each valve is like a one-way door. During each heartbeat, the valves open to let blood flow from their chambers and close to stop the blood flowing backwards. Heart valve disease means that one or more of your heart valves don't open or close properly. This can cause the blood flow through your heart to and from your body to be disrupted. There are a few types of heart valve disease, but they usually fall into one of 2 categories. Stenosis is when your heart valve flaps are thick or stiff and don't open properly. This can reduce blood flow, which causes strain on your heart. Regurgitation or insufficiency is when your valve flaps are leaky and don't close properly. This lets blood leak back through your valve and can make your heart work harder to circulate blood around your body. Most valve problems can be managed with a procedure or surgery to fix or replace the affected valve.
Aortic stenosis is one of the most common and serious valve disease problems. Aortic stenosis is a narrowing of the aortic valve opening, and aortic stenosis restricts the blood flow from the left ventricle to the aorta and may also affect the pressure in the left atrium. And application in medicine. In patients with several aortic stenosis who are at increased surgical risk, transcatheter aortic valve replacement or TAVR with balloon-expandable valves in comparison with the surgical valve replacement have significantly lower rate of rehospitalization after 1 year because it is less invasive. Surgical procedure.
TAVR is a minimal invasive procedure, stands for transcatheter aortic valve replacement. Aortic stenosis is a disease of the aortic valve. The aortic valve is like the door of the heart, and when it becomes narrow, patients become symptomatic, meaning they have shortness of breath, chest pressure, sometimes they even pass out. So a TAVR is a procedure that can replace the traditional open heart surgery. So the procedure starts with numbing both groins. We put lidocaine under the skin, and that prevents the patient from having pain. The patient will be under light sedation, and we will insert catheters. Catheters are plastic tubes that allow us to inject contrast or advance devices through them into the heart. We will then advance an aortic valve bioprosthesis. Currently at Tallahassee Memorial Healthcare, we have the 2 devices that are approved by the FDA to treat aortic stenosis. The Edwards valve is a balloon-expandable valve. The valve is mounted on a balloon. So as a stent, you will put it in the position that you prefer and then inflate the balloon. That will expand the valve. Once expanded, the valve is already functioning. The Medtronic valve is contained within the catheter. The Medtronic valve is made of a material called nitinol. Nitinol is a material that has memory, so the valve is always wanting to be in their original position. We put it inside of the catheter, and once it's in position, we release it by removing the catheter. The valve deploys itself. By treating aortic stenosis with a TAVR, we are making patients live longer and better. That means no shortness of breath or chest pain or passing out while doing their regular activities or even exercise. The evidence has supported that the FDA has approved this therapy for people with intermediate risk for surgery. However, there are at least 2 trials that have shown that this is beneficial also for low-risk patients. So the population that will benefit from this procedure has broadened. The heart team is composed by several people, from cardiologists, invasive and non-invasive, heart surgeons, nurses, anesthesiologists, coordinators. We all are with one mission, which is to provide that patient the best option available.
Pros and cons. Pros. Patients have lower rate of new onset at atrial fibrillation and have shorter hospital stays. And this type of valve has the advantage of having a more reliable, centering, and easy replacement, allowing more security during the procedure. And it It is a minimal invasive procedure, improves life quality and expectancy of patients with aortic stenosis. Cons. TAVR, or uh, of course, is not without it is risk. Generally, risk of this minimally invasive procedure include blood vessel complication, heart attack, or heart rhythmic abnormalities, kidney disease, problem with the valves in itself, and usually applied in Ecuador. It is a life-saving technique for people with aortic stenosis in which symptoms are threatening life. The clinical art and surgery area of the Hospital Teodoro Maldonado Carbo, since 2015, implemented a new procedure, transcatheter aortic valve replacement for aortic stenosis. Doctors in this hospital only have one type of valve for intervention with TAVR, which is the core valve with diameters of 26, 29, and 31 millimeters, and depending on the size of the aortic ring. In conclusion, patients with severe aortic stenosis with at low surgical risk, the rate of death, stroke, or rehospitalization after 1 year is significantly lower with TAVR than with surgery. Transcatheter aortic valve replacement as a treatment for aortic stenosis provides greater functional class of dyspnea and is also associated with the decreased hospital stay.
My name is Darren Appleton, and I'm an interventional cardiologist here at Virginia Cardiovascular Specialists. Today I'm going to be talking about transcatheter aortic valve replacement, or TAVR, and with a focus on a patient that we recently treated here called Mr. Huber, who underwent this procedure and had a really excellent result.
A little over 5 years ago, when my general practitioner noticed heart murmur. So he had a MRI done and then recommended that I see a cardiologist. And he recommended here, Virginia Cardiovascular Specialist. and I met with Dr. Appleton, and he diagnosed aortic stenosis. It was moderate then, and after about 3 or 4 years, it was severe.
He would really continue to report in that he was doing very well and having no symptoms. And so we were just keeping close eye on him for quite some time until a point where he really said, yeah, I don't feel as good anymore, and starting to really slow down notably as the valve problem was getting worse.
I'm a bicyclist. I ride a bicycle a lot, about several thousand miles a year. And starting last year, about 12 months ago or less, more than that, I realized I was riding with my same group of friends and on the same bicycle, same roads, and I was falling behind. I couldn't keep up with them, particularly on hills.
And so we opted then to discuss what would be the potential therapy options to fix his diseased valve. For a long time, the only way to replace the aortic valve when it became severely diseased was with a big open heart surgery. People decided that it would be good to have something to offer those people who are either inoperable because of their age and risk factors, or just high risk. And so some very innovative people came up with the idea of doing a much less invasive procedure, or transcatheter aortic valve replacement.
I was concerned about the progression of my disease, and I was also very concerned about open heart surgery. I was very fearful of that. I didn't want to have to spend 2 weeks in the hospital. So I was very happy to find out that the TAVR, I was a candidate for the TAVR procedure.
By taking the valve leaflets that are sewn inside of a metal stent frame, which can then be crimped down on a very small delivery catheter, which can be inserted through an artery in the leg. That valve is then implanted inside of the diseased aortic valve, usually by using a balloon to expand the valve, and that then basically completes the valve replacement without having to open up the chest, and so making it a much less invasive procedure. It always varies a little bit from patient to patient depending on different things that might come up in the course of the procedure or recovery, but the average is about 2 nights in hospital. And there are some patients who are doing so well that they might even go home the next day, as I think was the case with Mr. Huber.
About 2 weeks after the TAVR valve was put in, I was able to do, I got back on the bicycle and eventually working up and done 30 or 40 miles at a time is no problem for me now. Being alive and being active and feeling great, feeling well is tremendous.
And that's it. Thank you for your attention.